I'm currently a nursing supervisor for a home care agency. So I do nurse and site visits and provide concierge nursing services to those patients. So that's what keeps me busy as far as care plans and professionally. And then as far as the advocacy piece, I developed the NurseElleRose brand so that I can have that platform to speak on those different subjects like neuroscience and the things that I'm really passionate about. So I'm an official ambassador for the Alzheimer's Association under the Congressional 5th District of Georgia. And I'm very proud about that because I want to be the voice for other people, like I said, but also to just get that time and that preparation to do that has been an amazing experience. So you can follow me at NurseElleRose on Instagram, Facebook, and Twitter. And I'm in the process of developing my website now. So that'll be launching soon. So stay tuned. Everybody look out for it. And just, I'm always open. I don't shut myself down to answering questions. So if there's a message you can send me, I have a text link on there, email link, or just, DMs nowadays, anything like that. I try to get back pretty quickly and pretty soon with everybody. And I'm an open book. Right. I have a love for neuroscience, illnesses, and disorders because of my own struggle with epilepsy and more recently syncope. Also Alzheimer's disease. So I started to pursue advocacy for that because my grandmother actually passed last February 2018, of late stages of Alzheimer's. So I wanted to turn my pain into passion, and I decided to step into that realm because I wanted to be a voice for her, but also other loved ones and family members out there that have not gotten that resource or just the education behind what can be going on with their family members and everything like that. And as far as incorporating my nursing brand with what I want to do with my career goals, I feel that it's necessary for me to step into that because I've always been told I have a way with words, but I never knew how I was going to use them. And I knew I loved nursing so much, but I also knew that there's so many different ways to do that. So right now I'm in the process of fully branding myself as NurseElleRose, and it's been an experience because there's so many different aspects of this that I'm learning about myself while dealing with my own health issues and just being an advocate for everybody, including myself, family members, and just learning that it's been a roller coaster, but I'm excited for where it's going to go. In high school, I had 2 episodes of passing out while I was in dance line, but nothing ever indicated anything, and I was always typically healthy. So when I started having some symptoms in the late months of 2015, I knew something was wrong, but I was like, I'm busy, I'm young, I'm healthy, my son is fine, just keeping it going. But I started having some vision changes, and then I couldn't get up out of my bed. So when I was saying that, people were looking at me like, what do you mean you can't wake up in the morning and get out the bed? And I seriously meant that. So what was actually happening was I started having seizures in my sleep, and they would kind of paralyze me in a sense. So I had a lot of nerve symptoms and numbness. I had problems at work. I was tripping and stumbling over my feet. Had a hard time with IV. Stuff I was always good at, I knew something wasn't right, and I was constantly tired. So that constant chronic fatigue that I was not used to because I was used to being on the go. So I let my primary care doctor know about it. We had a really good relationship, and I told her, like, these are the things I'm dealing with. Like, we got to figure something out. This is not normal for me. I have a lot to do. Just trying to expose myself to, what could possibly be going on, but recognize, like, I had to slow down at the same time. So she sent me to a neurologist. They worked me up. They worked me up for MG. They worked me up for MS. And I could break those down a little bit, I guess. But, some of those degenerative nerve disorders. And I knew it wasn't that. I was praying that they weren't that because that's the type of patients that I treated. But in the same light, I wanted to know what was going on. So the neurologist at the time, he started me on some migraine relief and some pain management as well as physical therapy. So I was going really well with those, and then I had an episode. I was actually in my hospital parking lot with my son going to a sorority event at Georgia State, completely passed out in my car. didn't know what was going on. Still to this day, it amazes me, and I'm pretty sure that I had angels, including my son, watching out for me. We went ahead and reported that, and I convinced my sorority sisters to not take me to seek care, but they should have known something was wrong at the time. And I completely was disoriented, but still functional, but we knew something wasn't right. So they performed a EEG, which is like a brain study on your head, and they connected me. They did a study, and they determined I had some abnormal activity, especially when I was in my sleeping phases. So I wasn't put off work then, but I continued medication. I continued the physical therapy, but they just wanted to make sure I was okay. So over those next couple of weeks and almost into a month, I was doing everything that I was supposed to, but things weren't getting fully better. So they did a sleep study. So the sleep study was 3 days, 3 nights, and I asked to do it at my home because I was a little too embarrassed to do it in the hospital setting. That was just a pride thing. But I'm glad that I decided to do that because that's actually what diagnosed the epilepsy. So it's been 3 years now, and you know, my healthcare team, even they're fascinated with it because sometimes they don't even think it's seizures, and then they look at things and my symptoms are totally different. And the hospitalizations that I've had have confirmed, like, okay, well, she does pass out, but it could be syncope, it could be seizures. So they're real careful with me. So I call it a journey because sometimes I'm just like, I don't know what to do, but I have faith that everything will be fine.
Absolutely.
And one thing that I want to say to people is, even though things are going on, don't let it stop your shine. I've had several days where I'm just like, I don't know if I'm going left or right, but I know that God has guided me. And even if you're not spiritual or religious or anything like that, know that there is some divine intervention and power that is guiding you to your purpose in life, and just letting you know that you are special, you are loved. Even though things may not look like you want them to look, there is a divine intervention for you. And one thing I also say is, there's so many different routes to go about nurturing your own health. Just ask the questions and be open to ask those questions. Don't shy away from the opportunity to have those proper conversations, and don't feel like, oh, that's a silly question, anything like that. No, go ahead and, advocate for yourself. Advocate for your health, advocate for your wellness, because at the end of the day, you're going to be the one that's living in your truth and your purpose and that healthy well-being. So just, put on a smile. You might cry sometimes. You might, just question things, but don't stay there. Just make sure you keep it